that she can initiate, and then some that she needs assistance to move through the gait cycle. So when she gets into the platform walker, she can use her arms to support her upper body, and you'll see me giving support from her hips to keep her rear end forward, and then when her foot's on the ground, her knee doesn't have the strength to stay straight so that it doesn't collapse when she puts weight on it. So I'll be holding back, kind of aiding her quadriceps muscle, and then at the same time the other leg is trying to advance, so I give her support and bring the opposite leg through at the same time. So we get this beautiful dance of she does as much as she can, and I help her as little as I need to. And that leads to benefits like full range of motion, actively, improvements in circulation, postural strength, and wherever it may go from there as well. So.
I'm spending money like I just got paid. $100 bills, tell them keep the change. Come on. Pop a bottle, about to make it rain. Let me give you something now to celebrate. Come on. And if you're wondering why I move the way I do, I just feel so good, good, good. Oh, 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 I just feel so good. I see the world through my thrift store shades, rose-colored lenses and a fake gold frame. Come on. Playing old rock songs on an air guitar, posing for your picture like a superstar. Yeah, come on. And if you're wondering why I move the way I do, I just feel so good, good, good. Oh, 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 I just feel so good. If you feel it, just dance along. Keep the feeling going on and on. If you feel it, just dance along, dance along, dance along. Yeah. If you feel it, just dance along. Got to keep the feeling going on and on. Yeah. If you feel it, just dance along, dance along. Oh, it just feels so good. I just feel so good, good, good. Oh, I just feel so good, good.
So Dylan, what was your injury? What happened to you that caused your injury?
I had a T5 burst fracture through a car wreck I was ejected through the windshield. Top of the car crushed me. I had multiple hairline fractures on other vertebrae, two compressed discs on 9 and 10, T9 and 10 vertebrae, and crushed sternum.
How long ago did that happen?
It was on May 19th of 2018.
And what's been the progression of your rehab? What kind of phases have you gone through?
I went through a lot of crazy phases. I've had crazy spasticity to regaining muscle strength, a muscle tear that caused me to backtrack to the beginning and redoing everything all over. Exciting moments, down moments, everything in between.
What kind of advice do you have for if there's a patient with a new spinal cord injury? What kind of advice would you have based on your experience in rehab?
I would say never give up. Never let one thing interrupt your mind and your focus on what you want, because the smallest thing can happen and make it feel like you're not going to get anything back. And as long as you keep pushing through it, whether it takes 2 weeks, 10 weeks, 15 weeks, there's always a chance for everything to come back. And as long as you push it, the body doesn't forget how to use those muscles.
What has your experience at Premier been like? How would you classify Premier Physical Therapy?
Top of the class. It was a shot in the dark when we came the first day. We didn't know anything about Premier, and we were suggested to come here. And from the first day, it just clicked. Everything seemed right, and the intelligence levels, the drive, the intensity, the fortitude by the therapist here. They all want the best for everybody that comes through the doors. They don't turn anything down.
Can you comment on the creativity of treatment?
It's wild. Me and my therapist, we think of some crazy things, whether it's on the spot or we go home and we think about it and we come back and we just try something out of the blue that it could work, it could not work, it could go great, it could go horrible with a blink of an eye. It's all about changing things up and not getting stuck in a rut and plateauing.
Awesome. Sounds good.
Come to Premier Physical Therapy for their rehab process, because it's been shown, and I can see people that come through these doors that they get what they want to when they come here. They're getting everything that they want back.
Awesome. I'll give you a cookie later.
All right.
All right, so we've been highlighting some of the assisted seating, also featured some exercises we've done in the rickshaw for different tricep movement, push down, scapular depression, everything like that. This is where we see it all kind of come together in the pivot transfer that we're going to be doing here. So we'll go ahead and just get in position.
Sorry, that became a really, really long conversation.
Overnight. I'll be back later.
So pelvic tilt, lumbar twist, posture. It's important to keep the head up, keep a good pivot. Of course, balance is important here. And there you have it.
Watch, so good squat.
That's right. Do the squat.
1,
Good. Drive those hips
2,
all the way up. Tuck, 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 tuck the hips. Bring the head up. There we go. Drive the hips. Drive the hips.
So you just kind of press. Use your legs and get you up. Like that.
Perfect.
Yeah. Spasm, just keep still acting up.
Yeah.
And it's like 95% just my legs.
That's good.
Just hold my hand in there. So
Perfect.
that's how it works, man.
Yes. And then
Control.
yeah, nice
sit,
and easy.
Very nice.